Testing is what we are compulsively, obsessively focused on now. Both diagnostic testing, which is a positive negative, the antibody testing. We do about 20,000 tests per day, average, goes up and down a little bit depending on the day. We had a great meeting with the federal government this week and came up with a division of responsibility. I spoke to the other governors about it yesterday with the vice president on a all governors conference call. I spoke about the arrangement with the federal government. I hope the federal government and the other governors follow that template because it's a template that makes sense. We always said this was a federal-state partnership, and the president said that he understood the federal government had a role. We came up with a division of responsibility, which is basically the states take responsibility for the labs in their state and getting those labs functioning. We regulate those labs. And the federal government would take the responsibility of making sure the national manufacturers had the tests, the reagents, the vials, the swabs, all the equipment that the national manufacturer needs to be able to send to our labs so our labs can actually function. Our labs have these highly sophisticated machines that they bought from national manufacturers. But the machine requires the test kit and the reagents specifically for that machine. It's like you buy a printer from a company for your computer, like a color printer, but the printer requires cartridges from that company. You can have a fancy printer, but if you can't get the replacement cartridges, that printer is a paperweight, right? So we need the national manufacturers to have the reagents, the test kits, and that's what the federal government is doing. But it's working here in New York, so we're seeing the number of tests increase, and we want to get it stabilized and up. New York State is already doing more tests than anyone because we did get into this first. We were aggressive. We were pushing the line. So we're actually doing more tests per capita than any country around the world, let alone any state in the United States. As we're increasing the capacity of the labs, okay, so now our 300 labs are getting more equipment, more supplies, they can do more tests. Now we need more collection mechanisms, more places to collect the test data so they can send it to the labs, right? It goes collection, then send those samples to the labs run those samples, get the results back to the people. We have boosted the lab capacity to an extent where we need more collection sites now. So where do you get collection sites? We're going to authorize all the independent pharmacists in the state to be collection sites for testing. I assume, and my guess, and my educated guess, is that independent pharmacists will take us up on this. And there are 5,000 pharmacies in New York State. Some of them have already been doing it, some of the larger national chains, but if your local drugstore can now become a collection site, people could go to their local drugstore. There are about 5,000 in New York. They would be collection sites that would quickly ramp up our collection capacity. So we're doing that. And since we now have more collection sites, more testing capacity, we can open up the eligibility for those tests, right? We had a protocol with eligibility. Not everybody could get a test. And that's been a big complaint across the board. Everybody wants a test, and they couldn't get tests because we had a tight screen on the eligibility because we had a limited capacity to test. As you increase the capacity to test, you can increase the eligibility. And first responders, healthcare workers, and essential employees. Why? Because these people have been carrying the load, and they have been subjected to the public all during this crisis, and because they're public-facing. right? These are the people who you interact with. You get on a bus, this is the bus driver. You get in a subway car, this is the subway conductor. You are interacting with government, these are the people who you're interacting with. If they're infected, they could possibly spread it to a large number of people. So we're dramatically increasing the capacity with these groups. What are first responders? Firefighters, paramedics, EMTs, police officers, state, local, county, sheriffs, etc. Also correction parole officers, probation officers, people who are in the prisons. They can now go to the increased number of collection sites in the state. They're eligible to get a test. Healthcare workers, broad definition, direct care providers, healthcare practitioners, medical specialists, occupational therapists, psychologists, psychiatrists, residential care program managers. So if you're working in a residential facility, mental health facility, et cetera, community group residents, you're now able to get a test. And quote unquote essential workers. Essential workers are the people who've been keeping everything running. You know, when we say we closed down the economy, we didn't really close down the economy, right? We closed down the economy relative to what the economy was doing. But you still go to the store and buy groceries. Your lights are still on, right? Someone is picking up the garbage in front of your house. So those essential workers have been functioning all along. And these essential workers, and God bless them, we want to make sure they are now eligible for tests, again, because they've been working all along, they've been exposed, and also because when you go in to the dry cleaner, this is the person on the other side of the counter who's interacting with dozens of people a day. So we want to make sure those people get tested. As we continue to develop our testing capacity, and the labs are coming up to scale, the collection sites are opening, the more testing we have, the more we will open eligibility. Hopefully, one day we get to the point where anybody who wants a test can walk in and get a test, right? That was the dream. But we found out quickly that we couldn't do that. You have 19 million people in the state. So we had to prioritize. We're still prioritizing, but we're opening up that prioritization. The more capacity, the more tests, the more we'll open the eligibility criteria. We're also focusing on our healthcare workers and first responders. We're doing antibody testing for our frontline healthcare workers, and we're starting today, coming up to scale with 4 facilities in downstate New York. Obviously, downstate New York handled the bulk of the cases, not just in this state, but in this nation. So we're going to those hospitals that had a large number of COVID cases come in, and we're doing antibody testing there as quickly as we can and to the largest scale that we can. Elmhurst Hospital was one of the city's, New York City's public hospitals. When we talk about hospitals downstate, there are about 100 hospitals. About 11 of the 100 are what's called public hospitals. New York City runs them as part of their Health and Hospitals Corporation. Those public hospitals really saw a large number of people, and they were under stress. And they were under stress, frankly, even before the COVID situation. But Elmhurst Hospital, which made national news for the number of cases they were handling, Bellevue, Montefiore, SUNY Downstate, is now running a COVID-only hospital. So everybody in that hospital is a COVID patient. And you want to talk about God's work, that's where it's happening. We want to get them the antibody testing. And we're also going to do significant antibody testing in downstate New York with those frontline transit workers also. People who've been working for the MTA, they're Transit Workers Union, TWU members. They've kept the city operational. You need those buses and you need those subways. If you want to have the hospitals running, if you want to have the grocery stores running, those employees have to be able to get to work. And the MTA, the buses, the subways, they did that for us. God bless them, the MTA and transit workers. And then the police, the first responders who were out there because we have to be safe. And we have to be safe even during COVID. So NYPD was out there. They had a large number of people who became sick because of the situation. State police, same thing. So we're going to be doing significant antibody testing there. We've said thank you to the first responders, and we meant it sincerely. And saying thank you is a good start. People want to know that they're appreciated. But even better than saying thank you, actions speak louder than words, right? So show me that you're thankful and act like you're thankful and get me the help I need. I'm out here doing my job. It's my public duty. I get it. But I'm sacrificing myself. I'm sacrificing my family. At least show me support. And support is you have the equipment you need, you have the tools you need, and we're going to get you the testing on a priority basis because you deserve it.